Welcome to this week's edition of Health Corner. Today we're going to talk about female health. I'm Dr. Ukpaka as usual. I have invited a professor of gynecology with Georgia University, Russia, who is a consultant in gynecology and reproductive health in the UK. She is no other than Dr. Arpita Ray. Dr. Ray, welcome to Health Corner.
Thank you very much. Good afternoon, Dr. Ukpaka. Many thanks for inviting me in this platform, which is organized by Basildon Side by Side, and it will be a great honor to talk about women's health.
Thank you very much. I know there are a lot of people who would like to listen to you. Menstrual problems, chronic pelvic pain in our society, in the community is so common that we see that every day. And among the Black Asian ethnic minority group, this is so common that some of them don't speak out. But I know that you're going to address this common problem. So if we have to start from the common one, what are the causes of heavy bleed or the pain they have in their pelvis, which is obviously their waist? Yeah, what are the common causes from your experience working in the community?
Now, if you are asking me about heavy bleeding as well as the pain, I think it changes with the woman's age, right? So when we see the young teenagers who has just started their period, usually they will experience heavy period and quite significant amount of pre-period pain, and that is usually related to anovulation. So they are not yet having regular period because their body's hormonal system is not yet well established, and therefore they are facing that problem. But when someone has got regular period, but it's very heavy in nature. Heavy in nature means whether it's going to affect your quality of life, it is making you taking time off from your work, or you are going through like very heavy flow when you are not expected to have this. So it has got in a mature woman who is beyond teenage, probably in their reproductive period, which is like, I would say, probably around 25 to 40, around that time. When they experience this kind of heavy period or pain along with the period, there are certain other reasons. It could be that they may have a polyp inside their uterus or inside their womb. They may have a condition what we call endometriosis, or they may have some tumors which are very benign. I don't want to make people feel panicky, but it is called fibroid, and within the Asian and the African community that is quite common. And those can always give symptoms of very heavy period with the regular period along with significant amount of pain. So that's more common. But when it's going more towards menopausal or perimenopausal, like 45 plus or 50, then you need to start thinking about certain serious things, which is whether there is anything sinister, whether there is any cancer which is with the lining of the womb. And in those cases, obviously heavy period will not happen with a significant amount of pain, but it will be very heavy period.
Right, okay. So, sometimes we have the young ones who have just started their period and they are complaining of painful period. Does that apply to them? I mean, I know they start having their periods from age of 9 or a bit?
No, it's bit less.
Right.
So they will be having their period. Normally we see probably 12 or 13 onwards. The girls will start having their period, and first 1 or 2 years they might face quite a significant amount of discomfort because it's something very new to them, and they are dealing with something which is beyond their childhood.
Yes.
They are still child, but they are experiencing the changes in their body, which is absolutely physiological. So therefore it is very important to educate people about that, and also educating the parents how to support those children at that time. So it's probably important to talk to their GP and getting some support like pain relief. At that point, you have got tranexamic acid, mefenamic acid, which is very well known, and it will not have huge amount of side effects, but will give those children their life back. And people or the parents or the mothers sometimes feel quite hesitant, like, I have got a very young child, shall I go and take her to the GP and discuss about this thing? So there are a lot of taboos or questions or queries within our community, and a lot of time from my personal experience where I have received WhatsApp messages from my friends or family with regards to these problems about their teenage daughter. And I think it's very important to talk about these things openly. And when these children, like they are late teenager, these problems are continuing. They're having very heavy period or having quite a lot of pain during the period, which is affecting their school life, or they are missing their classes or cannot continue with their study because of the pain. In those cases, I have seen a trend that these young children have been given pills or progesterone. But I think it's very important to explore, probably when they are 19 or 20, at that point, it's very important to think about whether these children has got endometriosis or these young women have got endometriosis or not. I'm not saying that everybody needs to go through a laparoscopy, because obviously we have to discuss about cost, benefit, risk assessment and everything, but it is something people need to be aware of, because endometriosis has got issues with a very heavy period, very painful period, but in the long run, when these teenagers or those who are in their very early 20s, when they are having or planning about their family, if endometriosis is diagnosed early, then at that point they can make an informed choice. So they are becoming more fertility aware at those points. So it is very important to think about endometriosis when you are seeing women in early 20s with very heavy period, painful period, or they are complaining of pain at the time of sex. And those histories needs to be explored in quite detail, not just giving them pills and say, okay, it will get sorted.
Right. So the message to parents is, if they have a daughter who is 12, 13, 14 and having painful period, at that age is really nothing to worry about. I mean, it can be normal.
It could be normal because it's their hormonal system in their body is just getting established, and therefore it's quite normal, but don't let them suffer. If they are having pain, then there are painkillers, there are certain specific medicine which will help them to reduce the amount of bleed, so therefore they can continue with their own lifestyle or their schooling, meeting with the friends and all these things.
All right. That's very interesting, because you mentioned endometriosis. A lot of people don't know what it is. But how common is it among the Black, Asian, minority ethnic groups?
It is quite common. It is quite common. I don't want to go into percentage or in the quotes, but it is something which is underdiagnosed within our society. First of all, sometimes people feel that, yeah, it's quite normal to have heavy period. Sometimes people feel, oh, I don't want to go to my GP and discuss about these women's things. And if there is that hesitancy, you are suffering in silence. So I think it's important to talk to your GP, or if you feel you can talk to your practice nurse, and you can take it forward from that point, because as I said, endometriosis means like when a woman is having her monthly period, what happens? Lining of their womb shades naturally, and that's what you will see as a period. But at the same time, for a certain proportion of women will have that similar type of lining outside their uterus, inside the ovary, or on the bladder, and therefore what will happen during the monthly bleed, when it's shedding the lining from inside the uterus, at the same time those external uterine lining type cells will continue to bleed, and therefore it will cause irritation inside the tummy, and those ladies will feel quite a lot of pain.
And a lot of people have ended up in casualty because of
yes,
severe
absolutely. I will tell you a story. You know, one of our common friend suddenly sent me a message few months back, and when in our community, within Indian community, when you talk to someone who is older than you, they call Didi. So that person called me saying, Didi, you know, I'm having severe pain, and it's like I'm going to die, and I have called 999, I'm going to go to the hospital. I said, fine, okay. And few days later, she comes back home and said, the hospital said, there is nothing to worry, there is no problem with my bowel, and it's all fine. I said, okay, it's good. And initially, because she is married, so I said, okay, when she first called me, I said, just rule out whether you are pregnant, because obviously severe acute pain will give rise to ectopic pregnancy.
Yes.
Few months down the line, again another call saying, oh my God, Didi, I can't bear this pain, and I also have very, very heavy period. And at that point, I asked her question, has they checked, or have you been referred to the gynecologist, because this is your second or third visit to the A&E with this severe acute pain, and has they ruled out endometriosis, or has they referred you to any gynecologist? And the answer was no. And at that point, I said, okay, as you cannot cope with this pain, you are going to get into the hospital, but please talk to them and ask them to have a gynecologist review to rule out endometriosis. So eventually, she got referred to the gynecologist, and these days, instead of laparoscopy, we can do more detailed scan, which is called MRI scan. And I told her, when you are seeing your gynecology consultant, please ask about endometriosis and just say, is it possible to organize a MRI scan? Few days back, she sent me a message again, Didi, you know, I had my MRI and it showed quite extensive endometriosis.
Right.
And obviously she's in a childbearing age, so therefore I said, okay, if they are going to do any surgery or anything, please talk to them about your fertility and your intention of like sort of getting pregnant soon, because any surgery related to endometriosis, or which is, it's like a catch-22 situation, because endometriosis can damage your fertility, but at the same time, when you are doing the surgery, the issue is it can, due to the surgery, it can damage the ovary. So those are the things. I think as long as people are more aware and we are talking about all these issues, I think we will identify things, we will deal with things much more quicker, and people will suffer less.
Right. And based on what you said, so what is the best test for endometriosis? Is it MRI?
I think, yes, diagnosis-wise, MRI is a non-invasive one, but clinical history. If you take a detailed history, and if any of the patient is saying, yes, I get very heavy period, I have got really bad pain during period, also ask whether they are having any pain at the time of having sex, if they are sexually active. That is a quite an important sign of deep endometriosis. Similarly, if you ask whether when you are having period, do you get any bleed in your urine or through your back passage? And if they say yes, these are again signs of having endometriosis has already been spread to other organs. So clinical history will raise suspicion of endometriosis, and it is an underdiagnosed condition in our country. In Australia, there is a trend that if they find someone with acute pelvic pain, very heavy period, even with the young women, they will offer laparoscopy to detect it. But that's not the trend here. But MRI is an option which is a non-invasive, but it will diagnose endometriosis.
Yes, I'm aware that ultrasound doesn't really help.
Ultrasound will identify if you have, which is the pelvic scan, an internal scan. It will identify if you have a big cyst from the endometriosis. That is, it will diagnose, but not if you have extensive endometriosis where it's in the bladder or in your bowel or in your behind the uterus. It will not get identified with ultrasound scan.
I know people might be asking, does it run in families?
There could be. It could. There are a lot of research. I will advise people to go into website of Endometriosis Society, and there are loads and loads of research going on about this disease, and there are some information coming that it's genetically related, there are genetic predisposition, there may be familial. Again, it's worth asking those history, and quite a lot of time patient will say, I don't have this diagnosis, but my sister or my mom has been diagnosed with endometriosis, and it should ring a bell at that point.
Yeah, right, okay. And I know that some people might be asking, is there a connection with lifestyle? Like, so if someone is obese, overweight?
Endometriosis, unfortunately, no. There is no lifestyle issues with regards to endometriosis. It's kind of why it happens. We don't know that yet fully, but we will find it among anyone. Within Indian population or Asian population, lot of time we get surprise finding of endometriosis, and it's a funny disease. You may not have any issues related to fertility because of endometriosis, and we might find endometriosis inside the pelvis at the time of doing cesarean section. On the other hand, some people may have some spots of endometriosis inside their pelvis, and they are suffering from subfertility.
Right. So on the other hand, again, so can someone have endometriosis and have no pain or serious pain?
It can. It can happen. It's not that it will be an incidental finding that you are doing laparoscopy for something else. A lot of time we have seen our surgical colleagues, they have done laparoscopy for something and then they have referred patient to the gynecology because they have seen endometriosis. If there is no symptoms, if patient is not thinking about family or they have already completed their family, we don't need to intervene about that disease. It's an incidental finding. But if there is some symptoms or patient thinking of family, then I think it's important to discuss about those issues.
Viewers, you've been listening to Dr. Arpita Ray talking about it's a huge topic, chronic pelvic pain and bleeding disorders. We're going to take a break. This is just the end of the first segment. In the second segment, there's still a lot to talk about. Don't go away. Welcome back to the second segment of this week's Health Corner. We have Dr. Arpita Ray, who is an authority in gynecology and reproductive health, sharing her knowledge around causes of pelvic pain, that is waist pain that doesn't go away, and bleeding problems among women. Dr. Ray, I know you've talked about endometriosis, and thank you very much for shedding very good light on what parents should do, especially when their young ones have pain during periods, and also taking us through endometriosis, which is extremely common. We didn't know it's that common, especially among BAME, the Black Asian minority ethnic group. So now there's one other cause of chronic pelvic pain in our communities and can cause heavy bleed as well. And this is what was known as fibroid. What is fibroid really? How can we explain fibroid to our community?
Yes. No, absolutely. Yeah, it's a very important topic from gynecological well-being of a woman as well, because fibroid is, if you think uterus or the womb from where the babies are born, it is like lots of muscles. So if I show you, like, this is the uterus, these muscles are like kind of interlaced with each other. Now what happens, if you have excess growth within these muscles, then obviously it will become lumps and bumps. So it's not like normal pear-shaped appearance of a normal uterus. It will be like this, or it might be like this. So it's all twisted and kind of bumpy kind of shape of the uterus. These are benign growths. So these are, people need to be very, very aware, like if someone has diagnosis of fibroid, you could be 99.9% assured that it's a benign tumor. The chance of cancer with fibroid is very, very, very less.
Yes.
But fibroid can happen in different parts of the uterus, and depending on its location, it can cause different types of symptoms. So as we all know, uterus is like sort of a muscular growth within our body. It has got an inner lining. If I show, this is the cavity, okay? So if you have this lumps and bumps inside the uterus, then we call it within the soft layer of submucous fibroid, and that will probably give you lots of symptoms and pain as well. And very heavy period. Because what happens at the time of period, the lining of the womb is shedding. If there is an irregular area, our body will try to shed it as well, but this is a muscular growth which is kind of indenting within the lining of the womb, and therefore the lady will feel excruciating pain during the period and will feel quite achy throughout the month as well, and there will be very heavy period. At the same time, there could be sort of fibroids within the muscle layers, and we call it intramural fibroids. So fibroid in between the muscle layer. They usually does not give you very heavy period, but if they are there, you might experience quite a lot of pain at the time of period. Similarly, there will be third type of fibroid, which is on the outer surface. So if it is like this, and if it is there, like as you can see these my knuckles, if they are there, so they are not causing any irregularities within the lining of the womb, but they are distorting the shape of the uterus, and they are called subserous fibroid. Usually subserous fibroid is just a muscle growth, but it will not cause you either heavy period or pelvic pain. But if this fibroid has got a big stalk, what we call pedunculated fibroid, then what happens, that fibroid, because it's attached with a stalk, sometimes because it has got a long kind of attachment, it might get twisted, and it's called, it can cause quite a lot of pain. So pedunculated fibroid or subserous fibroid will not give you any heavy period, but it's mainly the submucous fibroid which will cause more of a trouble. And when the submucous fibroid is more protruded inside the lining of the womb, we call it fibroid polyp. And those things need to be addressed if someone is trying for their family, because if the lining of the womb is irregular, obviously there will be significant problem conceiving, or there will be very high risk of miscarriage or failure to implant if someone is going through fertility treatment, and in those cases we will definitely advise that person to go through surgery so that this submucous fibroid or polyp can be removed.
Thank you very much for that. That's very very informative. One of the questions we always get from our community is, does fibroid run in the family, or is there a connection with hormones?
Yes, fibroid does run in the family, and it is very much estrogen dependent. You know, the estrogen hormone is a more female hormone. So therefore, if sometimes we see like people may have fibroid, didn't cause any botheration throughout the reproductive period, may be an accidental finding during some other scan. When these ladies, if they do not have any symptom and they are going through menopause, when their period has stopped, what happens? This fibroid will shrink in size because there is lack of estrogen.
Right.
So it's estrogen dependence, and also there is quite a good relationship with childbearing. So what is seen that any woman who has got multiple childbirth usually have less occurrence of fibroid. So in olden days it was told that it's nuns' disease because nuns never have children, and they used to have quite a lot of fibroid.
So does that mean that the older the woman is before conceiving, the more likely she can get fibroids? Or
no, there is no such relationship. But it's like if someone has got more children, usually the fibroid incidence is lower in that population, and it is seen more within the women who did not have children.
Right. So that brings us to another question. When people have fibroids, is it possible that they can still have fibroid and have children, or is it? It
is possible because mainly it's submucous fibroid which will cause miscarriage.
Yes.
There are systematic reviews, bigger studies which showed, yes, if there is submucous fibroid, it will definitely have an impact on childbearing. Subserous fibroid, which is outside the uterus, does not have any relationship with infertility. Intramural fibroid, which means fibroid within the muscle layers, has got, like, there may or may not be. So there is no definite evidence, but because it's within the muscle layer, there may have some impact within with the fertility issues.
Right. Thank you very much. So is it true that fibroid is the occurrence of fibroids is higher in the Black, Asian, minority ethnic groups compared to the Caucasian groups?
Yes. And no one knows why. It may be that within Black and Asian community, probably the estrogen level is high, nobody knows.
Right.
But it is evident that within African and Asian women, we will see more fibroids.
Some people have asked about the medications to shrink fibroids. From your years of practice, is there an option for medications, or is it?
It's always a temporary option.
Right.
If someone is kind of getting prepared for surgery, yes, the surgeon will give some injection to shrink the size of the fibroid, or they will kind of give some medicine or tablets, but not a long-term solution.
Right.
Because long-term solution, only solution you may think of is Mirena IUS, but it is not effective if someone has got a submucous fibroid.
Yes.
Because submucous fibroid needs to be removed.
And that's another thing, because I think a lot of your patients that come to you because they cannot conceive have fibroids, isn't it? And in such patients that want to conceive, is Mirena coil an option?
No. The patient, those who are, because the whole idea of Mirena coil is as a contraception or stopping heavy period when you are not considering about having a baby. So therefore, for a fertility patient, Mirena coil is not an option.
Right. Okay. So that's very good, because I know some people who, I know some people are afraid of having surgery, and they will say, oh, is there no medication? So in essence, it depends on what the person wants to do, whether it wants to have a family or he just wants.
Yes. So those again, that like sort of conscious decision making comes into question when you are having a consultation, and it will be a shared decision with the patient and the doctor, where doctor needs to talk about the fertility issues related to patient's expectation. Sometimes within Asian and African community, people will think if the uterus is removed, then my femininity is completely gone.
Yes.
So therefore they might suffer in silence and they might not come forward because they know they need to have surgery. And obviously surgery does have its own risk and its limitation as well. So all these things need to be discussed, and if the symptom is too much and it's not possible to cope with the symptom and it's affecting someone's lifestyle significantly or work-life balance, I think then it definitely needs to be addressed and needs to be removed.
So thank you very much for that. So for the benefit of the Black, Asian, minority ethnic groups as well, is there any other alternative treatment to fibroids? Because some people resort to non-conventional treatment.
I will not recommend because I'm not an expert. There may be some evidence, but I'm completely unaware of that.
Yes, I agree with you. I mean, I don't personally, I'm not a specialist in gynae, but I don't think that works.
No, we will not do.
Yeah, so viewers they have to listen to this, because people do give misleading information around fibroids. So if you have a fibroid, the expert is telling you there is no place for alternative therapies. Okay, so that's fine. So fibroids run in family, but endometriosis.
There may be a genetic relationship of endometriosis because there are lots of research informations are coming up.
Yes.
So it could be related. There is a genetic predisposition with endometriosis.
Oh, fantastic. Now, talking about chronic pelvic pain, I know the commonest, you've actually dealt with that. What about ovarian cysts? Do they cause
It
pelvic
can,
pain?
like if it is related to endometriomas, it can cause pain, or if it will not cause chronic pain unless it's undiagnosed. Sometimes we see patient is attending A&E with regular pain and never been advised to have a pelvic ultrasound scan treated for all other causes like irritable bowel syndrome and etc. And in that case, if it is a misdiagnosis, then definitely ovarian cyst will cause a significant amount of pain. But acute pain is usually with the torsion of the ovarian cyst, where the ovarian cyst can get twisted.
Yes. Oh, okay. Fantastic. And there's one of the conditions I know we see a lot. Infections, I mean, things like chlamydia, sexually transmitted infection, pelvic infections. How common do you see them in your practice?
I think within, it's quite low, I have to say.
Right.
It's not that prevalent, especially within Asian community or Black African community. It's not that prevalent. We do check people for their tubal patency, and sometimes we do see fluid collection within the tubes, which is suggestive of chronic infection, etc. But usually we don't see that many.
Yes, and this is an opportunity to ask the specialist. What is your advice to people about cervical screening, going for the smear?
Definitely do it, because it can save you big time from cervical cancer.
Right.
So do not opt out, always opt in.
Yes. Okay. And there's cervical screening, because I know some people
that's an issue, because I see within my community educated ladies, when did you have your smear? I never had my smear.
Yeah.
Which is not right.
Which is not right, isn't it?
Yeah.
Yes. And there's this, I think with the cervical smear now, they have to check them for some of these infections. Is it HPV?
That is HPV.
Yes. And what's this? The age is from 25?
It's from 25.
So
every 3 years from the age of 25 onwards. And when you get the letter to have cervical smear, you must go.
Yes. Okay. Viewers, you've heard the specialists talked about very difficult topic in a simple way. She's given lots of information about endometriosis, the causes of common pain, bleeding disorders. You've heard her advice. Go for your cervical smear. Go for your cervical screening because it saves lives. Now, the specialist has also advised on the different ways you can treat fibroids. It's not a contagious infection. It's something that can happen to any woman, and it's not the woman's fault. So in our communities, please, if you have severe pain, period pain, or a lot of bleeding, please go to your doctor and get checked. Don't stay at home and suffer in pain, because there's really support and treatment for all these conditions. This episode has just dealt with bleeding disorders and chronic pelvic pain. The next episode, we're going to be privileged to hear the consultant talk about infertility, because this is her primary area. Please don't go away and stay tuned. We will be back next week. Thank you and look after yourself.